Is PCOS getting a new name? Hello everyone, and welcome back to Experts Health Corner. Today, we're discussing a topic that is creating a lot of discussion in women's health. What if I told you that one of the most common hormonal disorders affecting women may actually have the wrong name? For many years, we've called this condition PCOS, which stands for Polycystic Ovary Syndrome. But some researchers now believe that this name does not fully describe what is happening inside a woman's body. That's why a new term has been suggested, PMOS. So what is PMOS? Why are some experts talking about changing the name? And what does this mean for women living with PCOS? Let's find out. First, let's understand what PCOS really is. PCOS affects millions of women around the world. It is one of the most common hormonal disorders in women of reproductive age. Many people think PCOS is only an ovary problem, but in reality, it affects much more than the ovaries. Women with PCOS may experience irregular periods, difficulty getting pregnant, acne, excess facial hair, hair thinning, weight gain, insulin resistance, anxiety, depression, and an increased risk of diabetes and heart disease. As researchers have learned more about PCOS, they have realized that this condition affects the entire body. And that brings us to an important question. Is the name PCOS still accurate? One of the biggest criticisms of the name PCOS is that many women diagnosed with PCOS do not actually have ovarian cysts. The tiny structures seen on ultrasound are usually immature follicles, not true ovarian cysts. Because of the word cysts in the name, many women become confused. Some women even think they cannot have PCOS because no cysts were found on their ultrasound scan. Researchers worry that this misunderstanding may delay diagnosis and treatment. Another problem is that the name focuses only on the ovaries, but we now know that PCOS affects hormones, metabolism, insulin levels, mental health, cardiovascular health, and much more. This is where the idea of PMOS comes in. Some researchers have proposed the term PMOS, which stands for Poly-Metabolic Ovary Syndrome. The goal is to highlight the metabolic and hormonal aspects of the condition, rather than focusing only on the ovaries. Supporters of this name believe it better reflects what science has discovered over the last decade. Modern research shows that insulin resistance plays a major role in many women with PCOS. Insulin resistance means the body's cells do not respond properly to insulin, causing the body to produce more insulin than normal. High insulin levels can stimulate the ovaries to produce more male hormones, leading to many of the symptoms seen in PCOS. Researchers have also discovered links between PCOS and chronic inflammation. Studies suggest that the gut microbiome, the trillions of bacteria living inside our digestive system, may also influence hormone balance and metabolic health. There is growing evidence that PCOS affects brain function, mood, and mental health as well. Women with PCOS are more likely to experience anxiety, depression, body image concerns, and emotional stress. Researchers have even found that women with PCOS may have a higher risk of cardiovascular disease later in life. All of these discoveries support the idea that PCOS is not simply an ovary condition, it is a whole body condition. However, there is something very important you should know. PCOS remains the official medical term used worldwide. Major international medical organizations have not officially replaced PCOS with PMOS. At this time, PMOS is still a proposed name being discussed by some researchers and healthcare professionals. So if your doctor diagnoses you with PCOS, that is still the correct medical term. The discussion about changing the name is not about creating confusion. It is about helping women and healthcare providers better understand the true nature of the condition. Whether it is called PCOS or PMOS, the message remains the same. This condition deserves proper attention and comprehensive care. Women should not focus only on fertility or menstrual cycles. They should also pay attention to blood sugar levels, heart health, weight management, sleep quality, mental health, nutrition, and regular physical activity. The more we understand this condition, the better we can manage it and improve long-term health outcomes. Science is constantly evolving, and as researchers learn more about PCOS, our understanding of the condition continues to grow. Perhaps one day the name may change, or perhaps PCOS will remain the official term. But what truly matters is ensuring that women receive accurate information, early diagnosis, and effective treatment. Now, I'd love to hear from you. Do you think PCOS should keep its current name? Or do you think a new name like PMOS better reflects what this condition really is? Share your thoughts in the comments below. If you found this video helpful, please like, share, and subscribe to Experts Health Corner for more evidence-based women's health education. And don't forget to download our free PCOS symptom tracker and lifestyle checklist using the link in the description below. Thank you for watching, and I'll see you in the next video.